Hi, welcome back to Isaac's Dentistry, back into our office here. Today I thought we would kind of go to a different realm here. Everybody knows the phrase among doctors, which is first, do no harm. So I thought first what we would talk about today is what to be looking for in a dentist, whether it's our office or in your dentist, and some of the things to be looking out for when you're choosing your dentist and when you're going in for a procedure. You know, a lot of people come in and say, I need a root canal. And they may not need a root canal. They may need an extraction, or they might just need a filling. Some people say, I just need my tooth pulled. And actually, we might be able to save that tooth, and you don't quite need it pulled. So we want to focus on the do no harm and things you should be looking for to get a good experience at your dentist and get the correct care and the care that you need in order to fix the problem you might have going on. So we've got Dr. Isaacs again today, and this all stems from one of his favorite books.
Hang on, but before you get into that, do no harm. Primum non nocere. That's the Latin for do no harm, and it's something I think about a lot. First, somebody comes in and whether albeit an injection or an extraction or something, first you don't want to make them worse than what they were when they came in here, and that's very important. So it's something we're always cognizant of. We want to make sure that before we do anything, let's make sure they're better than they were. They may think they're worse for a little bit, but we're there to make sure that they improve. So let's make sure that is up front. I'm glad you brought that up. About a week ago, I was cleaning out some of my old books that I had in my cabinet, and Scott saw this book, and it's entitled Dentistry and Its Victims, and he got a little chuckle out of it, and I started telling him about the history of this book. This book came out in 1970, and it was written, the dentist, it's written by a dentist, and he went under the name of Paul Revere. He called himself Paul Revere because he was the crier. He was the town crier. He was letting everybody know what was going on, like Paul Revere did in The Great Ride, or back in the Revolutionary War. So Paul Revere, the dentist, wrote this book, and Dentistry and Its Victims. It talks about what he got frustrated and was tired of people coming into his office and seeing the shape that people were in and saying they just went to their dentist and what should I do? And he says, well, it's already been done. So he was always putting out fires. So what to look for? Well, he called his the victims, the villains in this book, poor works. Dr. Poor Work is how he phrased it. And he noticed over time that if he would do a little bit of good over time, he could get them in better shape. So that's what our plan is. Scott also mentioned about we're going to get into consults here in a second. People will all the time call in and want to know how much the procedure cost, albeit a crown or a root canal or an extraction. So, and we try not to quote over the phone because it gets a little awkward. We don't know exactly what we're quoting. So we tell them to come in and we offer a free consult. Almost without exception, if somebody has a problem and they want us to look at it, we'll look at it. We might take 5 minutes, we might take an hour and 5 minutes, but we want to make sure that we've diagnosed it properly. And I don't want finances to interfere with how we're treating someone in that realm. So we also, if you're not, especially if you're not covered on some type of dental insurance, we will offer a free consult and free x-rays, because I can't diagnose anything without taking an x-ray of it.
And that's what I was going to also say is part of the consult here to make sure, again, we're doing the right thing to the right tooth is most times you have to have an x-ray so the doc can look at it and see exactly what we're getting into and what is that going on with each tooth and that tooth that's hurting. So that free consult is really important. Also, the x-rays that are included in that. So again, you can come in, sit down in a relaxed atmosphere, know you're going to get checked out, and whatever is needed for a diagnosis and the correct diagnosis, you're not gonna have to sell your car in order to get figured out. We're going to be able to take care of you with that free x-ray and that free consult.
Just to look at it to get you a good. That's the way I would like to be treated. I grew up with this. My dad is a dentist. He's retired, several years. I worked with him for 17 years. He was my boss, and then I took over and became his boss. But with that being said, I've seen it all come and go. I've seen good work. I've seen bad. I've been to When I was a kid, we had always had dentists coming over to our house. So I've heard it all. I grew up with this stuff. So I kind of get what the patient wants. So we kind of know what should be done. I would like to talk another thing about the whenever a patient calls in and asks what's going on, we have to see it. So we would really like to see you guys come in so that I can diagnose it. I can't tell you how many times the patients come in and they say they need a root canal and they don't. We either need extraction or it might be a chipped tooth or something like that. So that free consult that I'm giving you, not only that, we're kind of changing what needs to be done anyway.
Yeah, and to kind of put that in real terms, just today actually, we had a patient who came in, had seen their dentist a while back, and they were having some tooth pain. They thought it might be infected, went back to their doctor after getting a filling. Pain didn't go away. Doctor told them, well, I think you're just biting on it hard, just kind of shaved the tooth off a little bit and sent them on their way. They decided to come back in here because the tooth was still hurting and they noticed their gum was a little off. We took an x-ray, Doc did his free evaluation on him. Come to find out there was a lot of infection underneath that tooth, and instead of it just being chewing on it hard, the tooth actually had to be extracted. So there's things like that Doc would never have been able to tell over the phone. That x-ray and that seeing you in the chair and seeing you face to face, we're able to make a true diagnosis, and actually Doc's able to take care of it.
And a lot of people, when they call in, they want to just give me an antibiotic that'll get rid of it. Yeah, it might buy you some time. It's not going to get rid of the problem. An antibiotic will stop the infection, but there's a reason for the infection. You have to remove the etiology. It's not like if you have an infection in your, let's say in your stomach, and you take an antibiotic and it clears it up. What goes on in dentistry, it's sort of like having a thorn in your arm. You have infection around it. Yeah, the antibiotic will help that, but you have to remove the thorn ultimately, or it'll keep coming back. And it's not healthy to be going on and off the antibiotics. So that's another reason that we'd like to offer that. I would feel better if we could do that.
Now, and one of the things we really focus on here is we have people who might come in with multiple problems. They may come in and sit down and say, my teeth are a wreck, I've got all this stuff that needs to be done. And one of the first questions all of us here in the office are going to ask is anything hurting? Because what we like to tackle first is something that might be causing you pain. We can fix everything, and Doc's, one of his favorite phrases, let's put the fire out, and then we can deal with the smoke that's going on around it. So we always will ask that question of, is something hurting? And we'll try to fix the pain first, and then we can go and we can take care of everything else. And again, I think that falls into the do no harm realm, which is, getting the patient out of pain, getting them comfortable, and then bringing them back and do the preventive stuff before they get into pain or before that infection grows.
Exactly, and it's kind of fun. We use a lot of terms in here and a lot of layman's terms, and we kind of we try to add a little humor to it. But yeah, we have to put the fire out. And a lot of times I tell people that they ask me a question. Well, what about this? What are you going to do here? And I said, you're worried about your front door. I said, your house is on fire and you're worried about your front door. We're gonna get you a new front door, but it's going to be a while. It's going to be a few weeks before we put the fire out. You just call it. We say you just call your house is on fire. You just called the fire department, and here we are. We're going to put the fire out.
Right. Yeah. And we understand while you're sitting in the chair. We totally understand. When you smile, you want a nice, pretty smile. You want, we're all conscious of what we look like. But we have to then take a step back in the office and say, but it's more important to heal you and get you fixed and get you out of pain. We can always fix the cosmetic stuff, but that pain is only going to get worse, and it can also lead to other things. The infection can grow, the infection can spread. So Doc's real good about being able to take that step back and say, okay, we're going to fix that, but let's work on that fire. Let's work on that pain first. Let's get you out of pain, and then we can make everything look nice and pretty.
We have many ways of temporizing things to make it look nice just for a short time. We did one yesterday on a girl. She broke a front tooth off. She's going to have a few of them taken out and put in a fixed bridge at some point, but it's broken. What do? We can temporize it, buy her, get her through Christmas, get her through the first of the year, and we'll tackle it. So that's very common too. We can usually do some kind of quick fix, but keep in mind, if we put a temporary in there, it is temporary. Sometimes we tell people, hey, you can't even eat on this thing. You need to take it out and put it in your pocket. It's only for smiling. We had a few of those too recently.
We had one of those yesterday. So, Doc, let me ask this question. For anyone out there who has a dentist, or maybe they haven't been to the dentist in years, or, maybe they're just getting back out of college or whatever, and they're finally on their own and they need to start going to their own dentist and getting into that practice. What are some of the things that the folks out there should be looking for when they're evaluating whether it's a good fit for a dentist and them? I mean, there's places, I kind of refer to them as the dental farms, these big corporate-owned places. But what are the important things someone should keep in mind while they're looking for a dentist that can take good care of them?
I would think find a dentist that you feel comfortable with. If you find you match up with them, fine. If you can talk to them, that's good. Dentists, we're people too. We get conflicts. There's some people I irritate. Some people irritate me. If it's not a good fit, it's not a good fit. But if you want to talk about something, we can. And that's what we were talking about earlier. Some of these corporate dentistry, which is the way a lot of dentistry is going, is corporate. There's the Aspen. There's a few of them. That's one of the big ones right now. But they're selling a lot of stuff. So that's not our philosophy here. I want to keep that in mind.
Yeah, and I think it's important too, while you're evaluating what dentist is good for you, is your schedule, yourself really well. One of the things I like, and one of the reasons I was a patient here before I was an employee, is I like the fact that I had access to the office all the time. I first visit here, I was made sure that I had a business card, and I left with that business card, and there was a way to contact someone 24 hours a day, 7 days a week. I liked the fact that if an emergency arose, there was a way to get a hold of somebody. I didn't have to wait until Monday if it was a Saturday morning. So there's things to look at when you're going to pick your dentist, and personality is part of it, but also I think the amenities, what that office offers when it comes to evaluations and consults. One of the things I like that you do here a lot, Doc, is, we don't automatically jump to the high dollar fix. You take it what's necessary, not what's best for the bottom line.
Being in Central Kentucky, right in the heart of it, we realize, and I make jokes about that too. How, hey, if we were in East End, Louisville, we wouldn't be doing that. They do something different. But and a term I use for myself is I call myself a cowboy dentist. I practice cowboy dentistry. We kind of. Can you do it? No, that's not about textbook, but I can make that work. I can make it happen. So I pride myself in being able to make things happen like that. And that's what kind of keeps me going. It keeps me interested in something. Like the other day, we had a patient. They wanted implants, but they couldn't afford it. They wanted a bridge. Well, they didn't have enough teeth in it. So we went back to what we used to do 20 years ago. We put one implant in it and bridge off the implant. Now, dentists, we're not thinking that anymore. We're thinking, well, the implant, we're going to put all the implants in there. No, you can go with one and put a bridge off the implant. And it's something we don't even think about anymore, but we have to use a hybrid approach.
Right. And that's an important thing too, is one of the things we do a lot here in the office is when we have someone in the chair that needs a crown. The tooth is just it's in such bad shape it has to have a crown. Doc is very good, and we're good in the office. We want to make sure we talk that through with you. There are insurance things that go along with that. There's financial things that go along with that. We don't assume that everybody can just get a crown. So there are times where we could fix something with, say, a crown or a bridge, but we end up extracting that tooth instead because it's a back and forth with our patients. It's what are they looking to get done, and it's not us in the office forcing a certain procedure, even though it would work. We try to take that each patient's individual situation into account and come up with a compromise that is medically sound, that doesn't cross that do no harm barrier, but everybody can be happy and comfortable with.
Excellent points. And I just want to re-emphasize this. We'll kind of close it up, but dentistry and its victims, and are there victims walking around there? Absolutely. But if you have a question, come on in and see us. Another thing, what he was talking about, you'll leave here with my my cell number. I generally don't answer my cell phone, but I'll call you back. Texting's really good. I can get you a text if I'm out of town. We can call in an antibiotic and try to get you covered that way. So keep in mind there are a bunch of ways that this cowboy dentist can do it.
And to kind of just wrap on that point of access to care, a couple months back, we had a situation where Doc was out of town. He was in Lexington and gave me a call that there was an incident on a Saturday morning with a young child and had lost their tooth completely. And in a situation like that, some of these procedures, time is of the essence. The quicker you can get to it, the quicker you can start the fix, the more success you're going to have. So Doc was able to call me. I was able to meet the family here at the office, and I was able to get things started and get things in place while we waited for the doctor to arrive. He got here, and we were able to finish things up. Several months out, it's a success story. The child's been able to keep that tooth that was totally removed, and it's in, and he seems to be doing well. So that access that Doc was talking about, they sent Doc a text, and he was able to pick up the phone and get a hold of us here in the office, and we were able to put things in motion, again, to save time and hopefully save pain and future complications.
Excellent point. I forgot about that. But, yeah, I was on my way. I think I was on my way back home, and I got this text. I called Scott. Scott met him here at the office. Scott actually put the tooth back into it. Was completely a false tooth, knocked out on a playground somewhere. Scott put it back in there. When he came back in, we numbed him up and got it and temporized it and saw him. I can't remember exactly what we did, but I remember he came back in a month or two later, and he's doing well. I think we had to do a root canal on it. We had to open that up, or we're still waiting on it, I guess.
Yeah.
Okay.
Yeah, so hopefully we've given you a little insight into here in our office and what we try to do and how we try to work with you, and also some of those things that even if you're not coming to our office with your current dentist, or if you're looking for a dentist, things to keep in mind as you're out there searching and, shopping for who's the best fit for you in your dental work or future dental work you'll need. I would like to say, just here in our office, just to remind everybody, we are general dentistry. We also have 2 hygienists that are here on staff, so we have all week. We've got 2 hygienists here, so we take everything. We also have an orthodontist who comes once a month, so we handle everything from your cleanings and preventive all the way through the extensive work and the orthodontics work that needs to be done. We can handle all of that right here at Isaac's Dentistry. Anything to wrap up, Doc?
That's it. I think you did a great job.
Okay.
Anything else, Gary?
Well, thanks again for coming into our office. We've got an exciting one planned for you next time, so hope this was helpful to you, and we'll see you next year at Isaac's Dentistry. Thank you.